This segment sponsored by University of Maryland Medical Center.
So as we've been saying, it's Heart Health Month, and there's some free resources that you can take advantage of, right, Christina?
That's right. Ann Williams with the University of Maryland Medical Center is here to talk to us about having a healthier heart and why that means a healthier you. Thank you so much for joining us.
Sure, thank you.
Our heart health is such an important conversation.
It is.
Absolutely.
Why is
Definitely.
it so important to focus on heart health?
Well, you know, heart disease is the leading cause of death in the United States for both men and women, and over 600,000 people die each year from heart disease, and that really represents about 1 in every 4 deaths. So it's really important for us to know what we can do to try to stay healthy and keep our heart healthy.
Are there like early signs and symptoms that we should watch out for?
There can be, but sometimes, like with high blood pressure, that's why they call it the silent killer, because you really don't necessarily have any symptoms with high blood pressure.
Oh my goodness. And there are new blood pressure guidelines. Why are those so important, especially for us women, to know those new guidelines? And
Well,
what are they, if you can tell us?
Absolutely, it's really important to know. The new guidelines came out in November of 2017, and it's the first time in about the last 13 years it's been this much of a change. So it used to be that you were considered hypertensive or had high blood pressure if you were 140 over 90, and now it's lowered. So really, if you have 130 over 80 or above, you're considered hypertensive. So that's why it's important, because you may have before been kind of on the borderline and you may not have thought, oh, you know, I've got some wiggle room there, but really not. They've really lowered the guidelines.
Wow. Well, hopefully that will help a lot of people.
Hopefully.
And if someone is having a heart attack, what does it feel like? Because it's different, right? For
It can
certain
be.
people?
There's been some things in the literature that say that women experience it a little bit differently than men, but certainly you would want to make sure that if you have any shortness of breath, pain, it can be in the chest or it can radiate down the arm. You might break out in a cold sweat. You might feel lightheaded, dizzy, those kinds of things. You really would want to make sure that you call 911 or have somebody else call 911.
Gotcha. Yeah, definitely keep an eye out for any symptoms similar to that. So talk to us a little bit about what we can do in our everyday lives to keep ourselves cardiovascularly healthy.
Absolutely. There's so many things that you can do, really. A lot of people think that they can't. They say, I can't control my family history, that kind of thing, but you can do things. So the first thing is to not smoke, and if you do, try to kick the habit. The next thing is to try to maintain a healthy weight, and I know that that's hard, but there are ways you can do that by making sure that you avoid a lot of highly processed foods or a lot of fast foods. I know we just talked about donuts, and some of those are good, but in moderation, absolutely. And then really try to look at the amount of salt that you have in your diet and try to keep that.
That makes a huge difference.
And also, one more important thing is to make sure you get about 30 minutes of physical activity a day.
Okay, and it doesn't need to be super intense, hardcore, like
It doesn't.
CrossFit, any sort of movement is going to be good for you.
It can be walking. It can be dancing at home.
Oh,
you
that's
know,
what I
put
like
on
to
some
do.
tunes.
Yeah.
Exactly.
Put on some music and
so
you're
long
good
as
to
you're
go.
moving, because we
Yeah.
sit a lot of times behind computers and watching TV, so it's really important to get up and get moving.
For sure.
And
So
you guys are going to be at the BMORE Healthy
We
Expo.
will. We're
Has some
excited to see.
amazing resources. What did you bring today?
Well, I brought, we're going to be doing blood pressure screenings there.
Yeah.
So we'll be there all day, and we'll be able to tell you if you're high blood pressure.
Nice.
We also have some props here. You can see some of our models of fat. What is
my
it, 1
goodness.
pound or 5 pound model of
How
fat?
much fat
try
is
looking at that and then eating donuts.
I know.
How about this?
So the
This
big one I think
the
is
big one is
5
5
pounds.
pounds.
Okay.
Yeah, the small one is 1 pound.
Oh my goodness.
Yes.
So I'm going to go for a run later.
That's so
That's
scary.
right. It is. It is. But again, eating in moderation and really making sure that you stay active. That's what's really important.
And are there any other resources that we should know about that will be available at the expo? Of course, we can get our blood pressure checked, see if we fit within those new guidelines.
There'll be a lot of resources at BMORE Healthy Expo. It's always a great time to come out and check out all the different things. And we also have a lot of information online too at umm.edu.
Wonderful. umm.edu, is that the website we should go if we want to learn more?
/community /
Thank you so much. This
Thank
is such
you.
a great conversation.
Yes, thank you, Ann.
Thank you
We
so
all
much.
need it.
We do.
Definitely.
Okay, I'm looking away from the donuts.